Whenever people get neck pain, back pain or shoulder pain, the first thing that they think is that their pain is gastric in origin. The gas in the stomach is what is the reason for the pain. This is their assumption. The intent of my talk today is to elaborate further details into this assumption so that you can take decisions on whether to take tablets for your gastric pain or not. Whenever you take food, accidentally some amount of air can go into the stomach. That air will stimulate the stretch receptors in the stomach so that the brain knows that the air has to be emptied out. So that's why people burp. This burp is the body's attempt to eliminate the air out of the stomach, which is keeping the stomach distended. So the stomach does not like it to be distended, so it tries to empty that air or eliminate that air out of its own cavity. So this is a normal physiology. So whenever you drink a Coca-Cola or Pepsi or any aerated drinks, this phenomena is common. But there are instances when people burp for many times even without drinking anything, even without eating anything. That is a separate pathology. I'll talk about it later on. But our question is whether the air in the stomach can cause pain somewhere else in the body. There are instances when people burp for even 100 times in a day, irrelevantly, untimely, loud burps, but this is a pathology by itself. But it is not to indicate that they have so much of air in the stomach which is causing them to burp frequent times. It is the nerve which is responsible for this burping has got irritated somewhere in the pathway that is causing them to burp more, not really the air in the stomach. So it's nothing but a misfiring of the nerve which is giving the wrong information to the brain. So the brain is completing the reflex of burping, wherein the air which is coming out is not indeed coming from the stomach, it is coming from the lungs. But they think that since the air is coming out, they thought a lot of air is accumulated in the body. Indeed, it's actually a neural problem in the pathway of the nerve, not really an organ problem. Let us come back to the pain of gastric origin. Let's say that, hypothetically speaking, some amount of air is accumulated in the stomach. How this air in the stomach can cause pain in the mid back or upper back or even the neck? I was thinking about the physiology of that. For me, any pain to happen anywhere in the body, either the receptor level, there must be a stimulation. For example, if I have to have pain in my arm, I have to pinch my arm, I have to put some heat in my arm, or I have to put some cold in my arm, or I have to poke my arm so that the receptors which are responsible for picking up heat, picking up cold, picking up even pain stimulus will get stimulated, and then the message will be carried as an electrical impulse, and then it goes to the spinal cord. From there it can get little modulated, and then it goes to the brain, and the brain perceives it as a pain. So for any pain that should be felt by the brain, there should be a receptor level or end organ level pathology. There is one more level the pain can happen. For example, when the nerve which is responsible for carrying this information at the spine level or in the pathway level, if it is disturbed, then the brain does not know that the problem is in the pathway. The brain only knows that the problem is at the end organ level or at the receptor level. So even without having a problem here, the brain can perceive that there is a problem here. This pain is called as neuropathic pain, wherein there is no problem in the end organ. Because of the pathology in the nerve, it is actually behaving like a problem in the end organ. So the brain will get deceived here. One more way of pain is referred pain. Pain from one organ can refer to other organ. For example, when someone is having a cardiac problem, the pain can go to the left side of the arm. When someone is having a gallbladder problem, the pain can be felt in the epigastric region or sometimes even to the right shoulder. So this is called as referred pain, which is nothing but pain from one organ, cannot be expressed actually as an organ pathology. Brain cannot perceive that what's happening in the gallbladder, but when there is a stone in the gallbladder which is getting inflamed or obstructing the pathway of the bile, then the pain will be felt somewhere which is corresponding to the nerve. It can refer the pain in the epigastric region or in the right shoulder level. This is called as referred pain, and it has its own pathophysiology. Now coming to the gas causing the pain, will this air in the stomach travel somewhere in the middle of the back to cause pain in the back? What is the medium of transport? Will the air get mixed with the blood and travel in the area? I don't understand how a gas can travel in the blood and then go to certain areas in the body and cause stimulation of the end receptors. It is not possible at all. The gas cannot be traveled or transmitted in the blood vessel because the gas in the gaseous form should not be carried in the blood. If that is happening, it is actually called as air embolism, which is a medical emergency. So your air should not be carried in the blood in the airy form, it should be carried in the dissolved form. That's why the oxygen and the carbon dioxide, they blend with hemoglobin and they dissolve itself in the plasma, and then these gases are getting traveled in the blood. So the gases has to travel in the blood in the liquid form. It should not be carried in the form of gaseous form. In case if it is carried in the gaseous form, it is actually dangerous. It is called as air embolism, which is a medical emergency. It happens only for the people who are into deep sea diving or during some surgery or IV procedures or any paranormal situations. Alright, so otherwise air in the gaseous form cannot travel in the blood. Then how do you think that the air in the stomach will go to this area in the back and cause pain in the back? It is not likely. This air cannot even stimulate a nerve which goes and innervates this area. For example, there is a pain in the lower back. Lower back nerves are innervated by L3, L4, L5. For someone to feel pain in the lower back, either the lower back itself should be at fault. For example, someone should stab the lower back, or a cyst in the lower back that can cause pain, or the nerve that governs the lower back itself should be at fault. So how a gas in the stomach will travel somehow without any blood vessel as a medium? It cannot travel and go and stimulate a nerve in the lower back to cause a pain in the lower back. So do you understand? There is no proper pain pathway or any explainable pain physiology by which the gas in the stomach can cause pain in the lower back. But 90% of the people who get lower back pain, they first think that the pain is because of the gas. In fact, they use the term called catch. Catch is nothing but sudden freezing of the spine. Okay, this oftentimes happens in the morning time when they get up, they have a back catch. Okay, and they think it's because of the catch. But it is not a catch of the gastric, it's rather a problem with the lower back itself. You need to accept that you have a low back pain which is freezing in the morning, which is a hallmark sign of discogenic back pain. When there's a problem in the disc, you tend to get stiff in the morning when you wake up. It is definitely not a gas problem, it's actually a disc problem. The same logic is applicable to the neck. When you wake up with the neck stiffness, it's more of a disc problem rather than the gas problem. But it's very nice to assume and presume that okay, your pain is gastric, so that you can justify your pain for some time without even worrying about it, because gastric is not dangerous, isn't it? That's what the common assumption is. And even there is no consistency in the pain locality pattern. Some people will have shoulder pain, they think it's gastric. Some people, they have knee pain, they think it's gastric, wherein he's having arthritis, but he thinks the gas from the stomach is traveling to the knee and causing the knee pain. One of my patients, he stopped eating potato for 10 years because he thought potato is the reason for his gastric catch in the morning, so he quit the potato. But what happened? The pain was still the same. If you go to Ayurvedic doctors, they say you have Vayu in your body. Okay, Vayu is nothing but the gas. Gas cannot actually produce directly any pain. But as per the pain physiology pathway, there is no justifiable explanation to tell people your pain is coming from the gas. And even the term gastric is vaguely defined. For someone, the bloating is gastric. For someone, belching is gastric. For someone, the pain in the chest is gastric. The term gastric itself is not a clear term, it's a vague term. It encompasses a list of symptoms like burping and bloating, and then GERD, and then heartburn, and then discomfort in the chest, and then sometimes pain in the chest. Not every patient will have all symptoms pertinent to the gastric. Some will have some symptom more than the other. Some will have more of a GERD and heartburn than the bloating. Some will have more of a bloating and burping than the GERD. So it's a lot of permutations and combinations are there, depends upon how much their nerves are disturbed in their body. But in science, we don't have any clear-cut pathophysiology of how the gas can cause the pain. As a physiotherapist, I deal with pain. For the past 23 years, I'm seeing people with pain. And oftentimes I make a precise diagnosis of where the pain is coming from. Maybe I'm not curing everyone, but I'll be able to diagnose them. My experience is that whenever there's a pain in the shoulder, check the shoulder first. Whenever there's a pain in the neck, check the neck first. Whenever there's a pain in the back, check the back first. Get to know what are the structures which are in the back which can potentially cause the pain. Examine it and then try to treat that, rather than making a false connection of gas in the stomach causing the lower back pain. It is not the case. That's why you have to meet a physiotherapist or a doctor who knows the anatomy and physiology and pathophysiology of each and every potential condition that can cause pain. Examine the patient thoroughly and then identify the reason for the pain, rather than popping a pill for the pain, because the pill for the pain will not cure the cause of the pain. You are just mitigating the pain for time being and delaying the inevitable. One day the pain will come escalating up, and then you have to anyway pay the price for it. So before things escalate, try to diagnose the problem, diagnose the pain, okay, based on modern science pain neuropathophysiological model rather than your simple traditional assumptions of all this gas causing the pain. And definitely don't take all this gastric tablet because that will reduce the stomach acid content, which will cause other problem like vitamin D deficiency, B12 deficiency and so on, because the acid is important to digest the food correctly. If the food is not getting digested, it won't get absorbed properly. So even if you eat proper food, you won't get it absorbed, so you end up having other deficiency problem, which is anyway common nowadays. Even in people who are having gastric related symptom, check your cervical spine and the thoracic spine, the nerves, because the nerves are the one which governs the organ. If the nerves are at fault at the neck and the back, the organ also will be at fault. We think it's a food problem, I say it is a nerve problem. So identify the problems in the nerve, treat that and see what happens to the gastric. Alright, so this is what I want to say you today. I'll come up with more videos pertinent to gastric so that people will have better understanding and don't fall prey for the wrong treatments.